Hello, I'm John Bisson, a clinical professor in psychiatry at Cardiff University and also director of Traumatic Stress Wales. I'm going to talk about supporting people affected by traumatic events. Involvement in traumatic events, such as the Ukrainian crisis, can involve a variety of different stressors, for example, injury, assault, threat, displacement, loss of loved ones, loss of damage to homes and material possessions, loss of livelihood, loss of dignity, loss of infrastructure that we all often take for granted, social isolation, even basic needs such as shortages in food, water, shelter and safety have all been important things we've been hearing in Ukraine. And then there are many other different stresses that people are likely to be affected by, often at a very personal level. The reactions to traumatic events are very varied and vary from one person to another, irrespective of the nature of the traumatic event. They're influenced by our own previous experiences and our personalities, and it's very important that we don't think that everybody is going to react in exactly the same way. Some of the commonest reactions that we might expect are psychological and emotional reactions involving distress, such as grief reactions, anxiety, depression, and traumatic stress reactions. But also some people will describe more positive reactions, for example, developing hope, a sense of cohesion with others around them, going through the same situation. And for some people, they describe post-traumatic growth, so a sense of positive psychological change experienced as a result of the struggle with highly challenging life circumstances. Probably several of us will know people who have experiences ourselves of this, and certainly in my work, I've seen a lot of people affected by traumatic events who do describe post-traumatic growth. For example, talk of having a better sense of what their priorities are moving forward as a result of experiencing and going through a traumatic experience. Some people, unfortunately, will go on to develop conditions such as post-traumatic stress disorder. Post-traumatic stress disorder isn't the only condition that an individual may experience. Other conditions such as depressive disorders, anxiety disorders, substance use disorders are all not uncommon following major traumatic events. Post-traumatic stress disorder is perhaps the best known condition associated with a trauma, and this involves individuals experiencing re-experiencing phenomena to the event, so distressing flashbacks, powerful images that come into their head, and nightmares of what happened. Avoidance of thinking or talking about what happened, the feelings associated, and reminders that may trigger distressing reactions, for example, places, people, activities, television programs, other media coverage that can trigger distressing memories. And then the final group of symptoms for PTSD are those of increased startle and hypervigilance, so feeling jumpy or on edge, an increased sense of threat, feeling that the world is no longer a safe place and perhaps feeling in danger even though the danger has passed. PTSD usually occurs in combination with other conditions such as depression, anxiety, and it's very important not to consider PTSD just as something that happens on its own. It's important that we consider the individual as a whole and consider PTSD in combination with other conditions and other difficulties that an individual may be experiencing. For many individuals, the trajectory of their reactions to a traumatic event is not as marked as we perhaps might imagine they would be. When I first trained as a psychiatrist, I was very much led to believe that following a traumatic event, if somebody didn't develop a distress reaction, then that was a sign of something being repressed and that it would come out later. In fact, we know from a lot of research now that that's not the case. And indeed, this study, which was of people admitted to a general hospital in Australia following traumatic physical injury following a major traumatic event, the majority of people had what was called a resilient response, so one where they developed relatively few psychological symptoms initially, and that didn't develop into what we would classify as a mental health condition. Some people, of course, very importantly, did develop quite a marked reaction that remained marked for a long time afterwards. Others started off with a marked reaction that reduced over time, and importantly, some others developed no marked reaction initially and did develop a reaction over time. So when we're considering an individual's reaction following a traumatic event, what we shouldn't be doing is assuming anything. So what we should be doing is monitoring that individual and recognizing that some people will have no symptoms initially, but develop them over time. Some people will develop symptoms initially and they will continue over time, and others will improve over time and have a very limited reaction at all, and certainly one that wouldn't require mental health input, for example. The Interagency Standing Committee is a very important committee that's made up of a variety of different groups. So the World Health Organization, the United Nations High Commissioner for Refugees, and various other United Nations departments and elements of the United Nations are involved in this committee. It also involves key voluntary agencies that tend to be involved in the response to traumatic events, and a standing invitee is the International Committee of the Red Cross. So very important groups of people who throughout the world are helping to deal with traumatic situations and crises, whatever they are. I'd certainly recommend the guidelines on mental health and psychosocial support in emergency settings to you. And these have been translated into a variety of different languages now, including Ukrainian. So some of the key messages from IASC are people affected in different ways require different kinds of support. We shouldn't assume that everybody requires the same levels of support, and we should acknowledge that what we need is a layered system of diverse, integrated and complementary support provided by different people, by different agencies, by different sectors, and people with different types of expertise are all very, very important for an appropriate joined up response. Core principles include doing no harm. Unfortunately, we do know that doing some things, for example, being overcommitted to forcing people to talk after traumatic events can have a negative impact on some people. So we definitely want to do no harm. We want to promote human rights and equality, use participatory approaches where the individual affected is very much participating and co-producing what we're doing, building on existing resources and capacities. And these booklets and other ones I'm going to show you are freely downloadable via websites that I'm showing you as part of my slides. What IASC have argued is that step psychosocial care should start with social considerations in basic services and security, and then move up through a kind of a pyramid, with only very few people requiring specialized services at the tip, as it's shown here, of a pyramid. Although clearly we shouldn't think of this as being a one-way street, and the different elements of this system are all working together. So as somebody that works a lot in specialized services, I'm working very closely with people at different levels of this structure, and people with specialist expertise, for example, will be helping with the response at all levels. But actually strengthening community and family supports and making sure that people's basic needs are addressed are fundamental and are going to really help people to recover from stressful situations. One of the very important things to remember in this is that research has shown that the perception of being well socially supported following a traumatic event is very much associated with a better outcome. So, taking everything that we know into account, what are the overarching principles that should be underpinning any support we give? And providing practical, pragmatic support in an empathic and collaborative manner is a key one for me. We should be building on existing socioeconomic support structures, not least families and communities, who will very much underpin the recovery for most people. Honest and open provision of information is very important. Misinformation, not being honest in the provision of information can really set people back. And it's important that within our systems, we take this role and duty very, very seriously. Stefan Hopfel and colleagues from the United States did a lot of work to look at what sort of things we should be promoting to improve the health and well-being of people after traumatic events, and found that promoting a sense of safety, a sense of self and community efficacy, connectedness with other people, calming and hope are all vital ingredients for helping people to move forward. We should be avoiding over-medicalisation and further harm. What we don't want is a system that says you've been involved in a traumatic event, you will suffer a condition, you need mental health support, because that isn't the case for the vast majority of people. We shouldn't be over-medicalising, and we should be looking at the more pragmatic, practical supports that are really going to enhance people moving forward in the future. Of course, for a few people, there will be a need for a further assessment and treatment when indicated for conditions such as post-traumatic stress disorder, depression, other conditions that can occur, and for which, thankfully, we have some very good treatments to help people with them. Trauma-Informed Wales is an initiative that I'm involved in within Wales at the moment, and Traumatic Stress Wales have been working closely with the Adverse Childhood Experiences Hub within Public Health Wales. We're out to consultation on a framework document at the moment that describes 5 practice principles that should underpin an approach. And again, and as I go on, you'll see a degree of repetition in this presentation, which I don't apologise for, because I think there are some things that we just can't emphasize enough should underpin the approaches that we take. So a universal approach that does no harm encompasses community-led approaches, prevention, and specialist therapists to enable transformation within systems. So we're all linked in together. The approach is person-centered, where the person is always at the center. We're co-producing, we're collaborating, we're working across sectors to make sure that we identify, understand and support the individual's needs, promote safety, choice, collaboration, transparency and empowerment. Our approach is relationship focused. So safe, supportive, compassionate and trusting relationships are central to what we do. We focus on resilience and strengths, building these things in individuals, families and communities. And finally, we're inclusive. So we recognise the impact of diversity, discrimination and racism, of the impact of cultural, historic and gender inequalities, and being inclusive of absolutely everybody in society and what we do. An approach that I very much liked over the years, and I think that a lot of helpful information is contained, is the information produced by the World Health Organization and others concerning psychological first aid. This is an approach that in this booklet, as I've highlighted here and can be downloaded from the websites below, it focuses on providing practical care and support which does not intrude, assessing the needs and concerns of those individuals affected and helping them to address their basic needs, such as food, water, and importantly, information. Listening to people, but not pressuring them to talk, comforting people and helping them to feel calm, helping them to connect to information, services and social supports, and protecting them from further harm are all important things. And very importantly, this is not professional counselling. This is not only professionals, although I would hope that all professionals adhere to the principles of psychological first aid, but really the vast majority of people who are delivering psychological first aid won't be professionals. There'll be people in the community and very important people in the third sector, people working within local authorities and for local authorities, and the first responders, the frontline supporters of people affected by traumatic events. I would really encourage everybody who has one of those roles to read this guide. The guide and the framework are available in different languages, including Ukrainian, and again can be downloaded through the World Health Organization's website. So the World Health Organization's psychological first aid framework argues for a looking, listening and linking approach, which I think is a very neat approach to take. So observing for safety, for urgent basic needs and for serious distress reactions, listening to people who may need support and making contact with them, asking what their needs and concerns are, and helping people feel calm. And then linking people to address their basic needs and access services as appropriate, coping with problems, giving information, and connecting people with loved ones and social support. So in a way, the initial support work, the psychological first aid approach, helps to identify what people may need and linking some people with other services to access the help that they do need. I think the booklet is very helpful in terms of giving various very easy different sort of diagrams, such as this one on do's and don'ts. So it argues to be honest and trustworthy, respect people's rights to make their own decisions, being aware of and setting aside our own biases and prejudices, making it clear that even if they refuse help now, they can still access help in the future, and that we're taking a non-judgmental approach to people's needs and presentations, respecting privacy, keeping a person's story confidential if that's appropriate, and also appropriately considering the person's culture, age, and gender are all very, very important things. What we shouldn't be doing are exploiting our relationship as a helper, asking the person for any money or a favor for helping them, making false promises or giving false information, not exaggerating our skills. We shouldn't be forcing help on people, being too intrusive or pushy, and we don't want to pressure people to tell their own story. We don't share the person's story with others, and we don't judge the person for their actions or feelings. I think these are all really quite commonsensical in many ways, but it's always important to be reminded of these things, I think, when we're trying to help. The booklet also comes up with helpful ways to encourage coping in different people. It's very important to try and encourage positive coping strategies and discourage negative ones, whilst recognizing that it's not a one-size-fits-all. Different people will find different things helpful to them. So encouraging people to get enough rest, eating and drinking water as regularly as possible, talking and spending time with family and friends, discussing problems with people they can trust, and also doing activities to help relax. Walking, singing, praying, playing with children may all be helpful for different people. I mean, I've always found physical exercise a very helpful thing myself and would encourage it to different people, recognizing that this comes in different shapes and forms for different people. Finding safe ways to help others in the crisis and get involved in community activities can be very helpful things to do. Things like yoga, mindfulness activities, Pilates are all things that a lot of people I see now find very helpful to do. Doing art and craft-based activities are things that a lot of people will find very helpful things to actually cope with stressful situations. Things we should be discouraging are using substances, particularly excessively, sleeping all day long, or sleeping not at all, of course, and working all the time without any rest or relaxation. Not isolating from friends and loved ones, and not neglecting one's own personal hygiene needs are very important things. And of course, not being violent is another thing to actively discourage. Several of that list I've just been through can clearly be applied to ourselves as helpers, and it's very important to recognise that helpers can be affected and traumatised themselves. Vicarious traumatisation and other related concepts are being increasingly written about and spoken about. And although supporting people can be very rewarding, it can also be very stressful. Indirect exposure to traumatic events, for example, to listening to people's stories, can feel overwhelming at times. Perhaps we identify personally with particular people's stories. Perhaps we can think of things in our lives that are not dissimilar to theirs, which can make it even more overwhelming to hear about different things. We ourselves are prone to develop traumatic stress symptoms and other mental health symptoms such as depression, anxiety, compassion fatigue is something that's spoken about, burnout, and also moral injury, where perhaps we can't help people through various reasons as much as we would like to, and we feel guilty in a way ourselves for not being able to do that. These are all important things to recognise, not only in ourselves, but also in our fellow helpers. I think the psychological first aid booklet for helpers comes up with some very helpful tips for helpers. So thinking about what has helped you cope in the past and trying to use those sorts of things in new situations, taking time to eat, rest and relax, keeping reasonable working hours, dividing workload amongst different helpers. We don't want a system where different people are doing certain things more than other people. We need to achieve a balance in our workloads. Remembering that we're not responsible for solving everything. We can't, and there are certain contextual factors that won't allow us to do certain things for people. And very importantly, in terms of the participatory, co-productive approach, we want to do what we can to help people and communities to help themselves rather than doing things solely for people. We want to help people to do things themselves. Minimising our own personal substance use, checking in and supporting each other and talking with friends, loved ones or others we trust are all important things for us to be doing. Resting and reflecting, taking time to reflect on the experience for ourselves and to rest, talking about our experiences with a supervisor, colleague or someone else we trust is something that's very important to do. Acknowledging that what we were able to do to help others is very important. Sometimes it can feel as if we haven't done a lot, but even in small ways, usually and often we have done something that can make a real difference, and it's important to acknowledge this. Of course, we need to learn to reflect on and accept what we've done well, what didn't go so well, and the limits of what we could do. And I think it's very important that we create ourselves a continuously learning and improving system to help us with our own skills and to help the system develop over time. It's vital that we all acknowledge that we can be affected and that nobody's immune to being affected and needing additional support. And if we do, that we seek additional support if we feel we may need this. For example, if we're developing symptoms that we're concerned about, using coping strategies that aren't particularly helpful, or just feel overwhelmed and not coping with the situation, it's very important to seek advice and help sooner rather than later. Traumatic Stress Wales and the National Centre for Mental Health have developed what I hope and believe are helpful resources for people and those working to support people affected by traumatic events. Two of our key publications are supporting people who have been experienced by traumatic events, and a toolkit that goes hand in hand with this. The former is aimed at people who are supporting people, and the latter really is sort of an aid memoir for people using the tools that are being recommended within the supporting people booklets. Again, these leaflets can be downloaded from the Traumatic Stress Wales website and also from the National Centre for Mental Health website. The supporting people who have experienced traumatic events really runs through guidance for people supporting people, starting off what are traumatic events, what are post-traumatic stress disorder and complex post-traumatic stress disorder, and then some of the issues faced when working with people who have experienced traumatic events. It then gives guidance on how to help people with different presentations, for example, feeling scared and jumpy, flashbacks, strong memories, sleeping problems, including nightmares, feeling numb or dissociated, losing contact with reality, being easily upset and angry, having difficulties trusting and getting close to people, and feeling depressed. And then finally looks at barriers to accessing health and support and how to try and help people overcome those. Again, I would recommend anybody working in this area to read this this booklet, and also the toolkit, which has been translated into numerous different languages, again, can be downloaded from our website, and provides simple tools for people to relax their breathing, relax their body, deal with reminders of the trauma, grounding themselves using their different senses, hearing, seeing, smelling, etc., and helping people who have a flashback or are dissociating. A lot of people find it helpful to sort of plan a more balanced activity schedule, and so there's a balanced activity planner in there, and also how to manage anger and other strong emotions. And these tools aren't just helpful for people directly affected by traumatic events, they are often also very helpful for people supporting people affected by traumatic events, and we're often using the same tools to cope with our own emotions and reactions to what we're doing and what we're experiencing ourselves. So I hope that's been a helpful overview on supporting people affected by traumatic events. Diolch yn fawr, and please don't forget to go to our website if you would like some more information. Thank you very much for listening.